Most people use an EpiPen completely wrong. This mistake can cost a life.
Hi all, welcome to my channel. My name is Rose Renee, DNP. If you are a returning subscriber, thank you. If you are new to my channel, welcome, and I'm happy that you're here. On today's videos, we are breaking down a life-saving skills that every nurse, nursing student, or caregiver needs to know. How to use an EpiPen. Whether you're in nursing school, new grad, or working at a clinical settings or a loved ones, you will eventually take care of a patient who experiences anaphylactic reaction. So this video will show you exactly when to use an EpiPen and how to administer it step by step. And the biggest mistakes to avoid. Let's get into it. So first, what is an EpiPen? An EpiPen is an epinephrine auto-injector that is used to treat anaphylaxis reaction. And many people can develop an anaphylactic reaction from food such as peanuts or medications or and other allergens. So it's important to know what someone is allergic to and make sure that they have an EpiPen readily available. All right, so the EpiPen is used to treat severe anaphylactic reaction, and it works by reversing the swelling in on the throat area. So that means it works by opening up the bronchioles airways. This means that the EpiPen is not optional, but critical. Now, when should you give an EpiPen? It should be given at first sign of anaphylaxis. Here's what to look for: difficulty with breathing, wheezing, swelling of the lips, the tongue, the face, the throat, complaints of feeling faint, dizzy, low blood pressure, hives, or generalized rash. Some people may have vomiting or diarrhea, or you know that they've been exposed to a known allergen and know their prior allergic reaction to that allergen. If you're unsure, give it. Delaying epinephrine is more dangerous than administering it. Now, this is a trainer epinephrine. I will be demonstrating the step-by-step proper use of an EpiPen. Okay, step one, if there is a clear case, you need to remove it out of the case. Okay, so this is the safety release, and this is the gray cap that you'll be removing prior to injection. So you need to hold it like a fist, okay? So step one, we're going to remove that clear case. Step two, hold like a fist. Remember, blue to sky and orange to thigh, okay? So you're going to be twisting this in the direction that it tells you. So I'm twisting that. Remember, you need to release that safety pin. So pull it up. That's your step three. Pull up that safety pin, right? And then you need to inject into the outer thigh. So just as so. Hold it there for 3 seconds and make sure you leave it there for that time so that medication can get into the muscle and to the body so it can act or be effective. So once done, you need to massage this area to make sure that we're giving it that extra boost to get to the muscles, right? Don't forget, you need to call 911 and remain with that patient because there are rebound reaction. And if that happen while you await medical emergency, if it's been longer than 10 minutes, you can re-administer another epi. Now, there are a few common mistakes that you need to avoid. One is not calling 911 at the right time. Two is injecting on the wrong side. You should be injecting on the thigh and the outer part of the thigh, not on the arm, not on the belly, not anywhere else. Okay. Three, although it's okay to inject through clothing, but you shouldn't inject through thick seams or jeans because it wouldn't really get through deeply into the muscle, and that defeats the whole purpose, right? And the last one is not staying with your patients to monitor for any rebound reaction. What to do next? You need to call 911 immediately because the epinephrine will buy you time, but it does not replace a medical emergency. All right, so after you administer your epi, you need to also do these few things. You need to lay your patient flat unless there are signs of vomiting. You need to monitor their breathing, their airway. You need to remain with the patient to monitor for any rebound reaction, or if there's a delay with EMS, a second dose of the epinephrine may be administered. Now, RN students, follow me for more life-saving skills made simple. If this video was helpful to you in any way, please like, subscribe, and share. Don't forget to watch my next video on S-bar communication. That is an easy form of communication to your provider or your coworkers. I'll see you on the next one.